another program called Independence at Home program. So there's a strong recognition of advanced practice nurses in all of these programs. Nurse home visitation services, another program that's going to really focus on families with children or other dependents. I mentioned school-based health clinics, nurse-managed clinics, and increase in reimbursement for advanced practice nurses. So this is going to be something that certainly Regis, we are going to be looking at very, very carefully, because as this money becomes available, we certainly want to see if this is money that we can use to help our students. So there's an expansion of the nursing faculty loan program. As you know, one of the problems in nursing, and one of the reasons there's a shortage, is we can't educate enough people. We don't have enough faculty to teach them. So this addresses that problem, and also there's even a new grant program for people who are already in master's or doctoral programs. So there may be some money that you can all apply for. Well, there's also an effort to try to get people who are already working as nurses to retain them, but most importantly, to get them to get their degrees. And there's a grant program to do that. Nursing diversity grants. We need to have a more diverse workforce, and this really would target minority students and people that want to be nurses or other health professionals as well. There's something called the Public Health Investment Fund. There are so many grant programs in this national legislation. One thing that I thought was really interesting, there's a real recognition about the importance of geriatric nursing. Some of us are getting old more quickly than we would like. But there is going to be a huge need for advanced practice nurses, particularly to work with the elderly. And so there is a program specifically for that, a grant program that will specifically get advanced practice nurses educated. Traineeships, and again, at Regis we have a geriatric nursing certificate, and so we are looking at that because we know that's going to be a big area in the future. Public health workforce loan, these are not just nurses, but other people working in public health, community health workers, and mid-career professionals that want to work in public health. Pediatric healthcare workforce and direct care worker training. People here, how many people here are social workers? Okay, well, we have some. Social workers would be eligible for this grant program. And basically to work in behavioral health that are areas that are underserved. Okay, so this is just my last two slides. I'm just listing the, summarizing the programs for nursing in the bill. Each one of these is its own particular section. There's a lot on the web if you're interested. And you can see that there's a huge investment in primary care with a real recognition of the importance of advanced practice nurses and getting more nurses educated and in the pipeline to really meet some of the needs that we're going to really have over the next 25 years and beyond. Thank you.
Well, as many of you know, the health care bill has been signed, but the implementation that we've been talking about today is staggered. Some things will be for this year, some for next, and some things won't get actually implemented till 2014. So everything isn't going to come online right away. It will give us some time to adjust and to get some of the programs put in place.